Today, we're diving into the evolving world of integrative fertility care, where ancient medicine meets modern science. I am so thrilled to be joined by Dr. Lee Hullender Rubin, an internationally recognized award-winning doctor of acupuncture and a true leader in integrative reproductive medicine. Dr. Lee is the founder of Rosefinch Health in Portland, Oregon, where she brings together more than 2 decades of clinical experience supporting fertility, IVF, pelvic and vulvovaginal pain, menopause, and perimenopause, as well as cancer-related care, all through a deeply compassionate, evidence-informed approach. In addition to her clinical work, Dr. Lee is also a respected teacher and researcher, having authored over 30 publications, and she's the founder of Rosefinch Academy, a continuing education platform shaping the future of fertility-focused acupuncture, with new public courses on fertility and menopause launching this year in 2026. In this conversation, we'll explore how acupuncture fits into modern fertility care. We'll take a clear and grounded look at photobiomodulation therapy, which includes laser and red light treatments, and also look at transcutaneous electroacupuncture stimulation, or TEAS, what it is, how it works, and how it can help enhance fertility. So, whether you're navigating your own fertility journey, or you're supporting patients, or simply curious about the future of reproductive health, this episode offers insights, clarity, and hope. Thank you so much for joining us today. All right. Well, welcome, Dr. Lee, to the Women's Health and Fertility Podcast. I'm so honored to have you here on the podcast today. I have taken so many of your classes through the Rosefinch Academy, as well as through other conferences, and I'm just so thrilled to have you on. I've learned so much from you over the years, and I feel like we're in this amazing community of fertility acupuncturists together, and the Aborum group is such a wonderful resource for all of us, not just for practitioners, but for patients too. But I wanted to specifically focus today on photobiomodulation therapy, as well as TEAS, which is what trans electrostimulation acupuncture. Okay, I'm gonna let you. I'm gonna let you talk. I'm gonna just say TEAS, which is a great modality for patients to be able to incorporate at home.
Yes.
So, but first, I'd love to start with you telling us a little bit about yourself and your journey to Chinese medicine and how it all started for you.
Thank you. And first of all, thank you for inviting me to be here. We've been at conferences together and I really appreciate that you get benefit from the classes that I put on, but also it is really, I agree, it is so important for community, especially now, like building community within the fertility space, within the practitioner space, that we all are in a network and know that we're not all out here doing it alone.
Hmm.
Um, So, how did I get into fertility? Well, I'm an adopted person, and it wasn't very apparent to me at first, but it did later. That I found in my master's program, I found helping people conceive was just like so infinitely interesting to me. Like all of the things about reproductive medicine, I could spend hours very focused on learning as much as I can, both from the biomedical side and from the East Asian medicine side. And so, I was really fortunate to get that exposure in my grad school program and then be mentored immediately after I got out of school with someone who worked in an IVF center. And at that time, this is the early aughts, the early 2000s, the study that had been talking about acupuncture for fertility, the Paulus study, which is like the
Hmm.
first one that showed doing acupuncture on the day of embryo transfer could improve IVF clinical pregnancy outcomes. I was in her practice at that time, and she was already very well established and was a major referral source, but it just then lit a new interest in me about clinical research. So I have, in addition to have been a clinician for over 24 years, I'm now also a researcher. I've published about how acupuncture and whole systems, traditional Chinese medicine, can support people going through IVF. I've looked at other things that are sort of adjacent to that, which is like vulvovaginal pain or genital pain, and as well as endometriosis related pain. lots of different areas, very related to reproductive health. And I now am just like so deeply interested in helping people to build their family who want to, and to provide them with the support that they need to be healthy, not only to become pregnant, but also healthy after they deliver their baby.
I love that. I think we share a very similar passion, Dr. Lee. And I can't thank you enough for all of the research that you do and what you share with our community because
Mm.
it's tough to publish. I know how much
Yes.
work it is to publish
Yes.
for
It isn't. Thank you for
acupuncture
that. And you're
and to
welcome.
conduct studies. It's like another full-time job, I'm sure.
It
So
is.
for you to be able to balance all of that teaching, research, and practicing and taking care of your patients is like you're like a superwoman, basically. I feel like you're wearing
Thank you.
the hat of many, many people. So
We all do in our own ways. Yes. But thank you for that.
yes, and I wanted to ask you too, like as far as the evidence-based medicine piece, how did that kind of land for you, or how did you decide like this is something I want to do. I want to continue beyond, the walls of my practice and start getting into research.
I am very curious. I want to know
Love that.
that I'm always curious, almost to a fault. Um, I always want to practice it with integrity. I want to articulate what I know to be true about effectiveness. And when people were asking me, well, how do you know that this works? How do you know that this is beneficial? Yes, I am observing it in clinic, and there
Hmm.
is value in that observation. And what is also helpful for everyone else is that can we look at this with multiple people? So, like a single person does not make a population, but also a population does not make a single person. And
Hmm.
I really think it's important um, with my central tenet of practicing with integrity is I wanted to make sure what I was doing was helping. And that required that I also add in skills around research. And I
Hmm.
had to learn them and go to a formal program. I went to the Oregon Health and Science University and did a postdoc program, specifically postdoctorate research clinical training program called the Human Investigations Program. It was funded by the NIH. It teaches you how to be a clinical researcher. It tells you, it treats you, or not treats you, it tells you about epidemiology, how to set up trials, how to write grants, how to do all that stuff. And those are really, really special skills.
Hmm.
And
For sure.
they're hard to do well. Like you can learn how to design a study, but there's also other things you have to think about. Like, well, you also need to be able to enroll, right? Like, so how do you set up your study so that you can actually enroll people who want
Hmm.
to join the study? And then how do you treat everybody ethically? And then,
Hmm.
all of those other things. So, I really think the thing that drove me to this is that curiosity, that wanting to practice with integrity and to really be able to communicate to folks that this
Hmm.
is what I know to be true about what we're doing.
Is there any particular study that you're currently in right now?
Oh, good question. Yes, I am
Putting you on
actually.
the spot a little bit, Dr.
Yes, I
Lee.
wasn't expecting that. That's totally fine. So I am working with a great group uh, at the university hospitals in Northeast Ohio. They're in Cleveland, and they're connected with Case Western University, but they are a hospital. They're an academic hospital. And they have an IVF program there. And there's a person, this wonderful provider who's one of ABORM members. Her name is Christine Kaiser, Dr. Christine Kaiser. And she has been there for, I don't know, 7, 8 years. And she's the endowed chair of reproductive health in the Connor Whole Health or Connor. I'm so sorry to them. I'm messing up the name of their organizations, the Connor Integrative Health Clinic. And they support people going through IVF, and they collaborate with the reproductive endocrinology clinic there. So we have 7 years, 6 years of data where they've done whole systems traditional Chinese medicine
Incredible.
as an adjuvant or as an add-on to people going through their frozen embryo transfers. And so we are in the process of actually looking at outcomes up until March of 2025. We now have the birth outcomes, and we have a paper that's in process right now, just kind of describing who are those folks, like what what are some things that are really common about people who chose to add in whole systems traditional Chinese medicine? So that's really exciting.
Love that. And I love that it's about, you're integrating the care, but you're also your study is around frozen embryo transfers because I feel like
Yes.
the great studies from the past, like Paulus and even Dr. Magarelli and Diane Credenda's studies were more like the fresh transfers. So there's great
Same.
data
Mine too.
there.
Yeah.
Yeah, and which was, amazing. So grateful for all of that data. But yes, around frozen embryo transfers is something that I feel like is kind of missing, or it's
Yes.
developing. I should say it's developing.
Well, it's a huge gap in the literature right now, and
Hmm.
it's very expensive to run a trial. Um, and so one of the ways that we can at least start looking for signals and if it's worth doing a randomized control trial is to do retrospective cohort studies. And what's
Hmm.
great about doing it in an academic hospital is you have access to electronic health records, right?
Yes.
And so that's fantastic because it's a wealth of information. You get all the diagnoses, you get all the visits, you get all the treatments. It's more easy. Is that a great? It's easier
Hmm.
to do the analysis.
Yes, definitely. And for the listeners that don't know what a retrospective study is, would you mind
Mm.
just defining that real quick?
Sure. Like when you think about a randomized control trial, before you start the trial, you design everything in front of it. Like you're saying, who are we going to recruit? And then what are we going to do? And what are the people going to do in the control arm? And then how are we going to decide what are important for us to learn here? What are our primary outcomes? For a randomized, that's the randomized control trial. For a retrospective cohort study, you're actually looking at data that's already been collected
Hmm.
and you're looking back in time. You're following like a group of people that are similar enough, and you make your research question. And our research question is, did people who added whole system traditional Chinese medicine to their frozen embryo transfers have an impact on their live birth rates? We're looking at live births, which is really the last outcome that is most important for us. Did they take home a baby? So
Right.
you're looking again at a group of people who are all kind of moving through time together, who are going through frozen embryo transfers and looking at outcomes of that group. So it's observational study. You didn't randomize them. You didn't actually choose before you enrolled them in a study. They've already done it. And so
Hmm.
it's from a practical standpoint, it's a lot easier to do this kind of study
Sure.
because you don't have to enroll them, but and the data is already collected. But the problem is that, you know, you're not randomizing, so you're not controlling for certain biases that
Hmm.
could show
Hmm.
up, um, and you can address in a prospective study. Is that clear? Is
No,
that
that's
answering
very
the question?
clear.
Okay,
No,
good.
that's great. It's excellent. I'm so excited about it.
Me too. Me too.
Yeah. Well, let's jump in a little bit into the photobiomodulation questions that I have for you. Well, first, we should probably start off for listeners that are not familiar with the term. What is photobiomodulation therapy, and how can it be used for enhancing fertility?
Great questions. I think the first thing is look at the name of the therapy. It's photobiomodulation therapy, and quite simply, it's looking at light and using light to change how the body works. And so photo means light, bio means biological processes, and modulation means change. So photobiomodulation therapy or PBMT, it can be delivered in multiple ways. You can do it with LED light panels, and I have one here if you want to see it.
Sure.
And it can be done. You can't hear me right now. Hold on. Come back to the microphone, Lee. Uh, there's like this is a Soluma LED array. There is lasers that are with red and infrared light. There's This is the new one. This is really interesting for people with like post-COVID issues,
Hmm.
neurocognitive issues. There is a intranasal
Oh,
LED array, which are these little guys right here, and you put it
wow.
in your nose, and
Uh-huh.
there's like a preset setting here. They've got an infrared LED, a red LED. They have a blue and a yellow, and they have different functions.
Would that one be recommended to be used more at home for like self-care?
Yes,
Okay.
exactly. It's really great. for cognition, for
Mm,
energy, for memory, and stress management.
I love
So
that. Okay.
yeah, I can give
Very
you a link
cool.
for that particular, and it's actually evidence-based, that particular one, which is great.
That would be amazing. Thank you,
Yeah,
Dr.
I'm happy
Lee.
to provide that. There's
And
always
there's,
more, there's lots happening here, but let me
yeah.
just say the different ways also. Laser is the big one. It's also the more regulated one. So like you wouldn't
Mhm.
want to buy a laser and just use it on yourself without any guidance. So you have red light laser, infrared laser, you've got LEDs with lots of different colors. And what's wonderful about this is that it's really pretty actually safe, especially the LEDs. It's
Mhm.
non-thermal. It's not generating heat to destroy tissue. You might feel like the LED panel get a little warm. It's not actually generating heat for therapeutic purposes. But it's also, aside from putting it in your nasal cavity, it's largely non-invasive. So it's
Mhm.
really gentle and it's great for the folks who are needle averse.
That's right. So when patients are using something like a Soluma LED panel, I think this is a question that I get a lot because when we do it in our clinic, we are using the LED panel, the flexible panel over the abdomen, over the needles. So, of course, it's not getting as quite close to the skin. So, the question that I get oftentimes is it better for me to, when I'm using it at home, if I have my own device, should I just apply it directly to my skin or to my
100%
abdomen?
yes.
So, I think your
Yes.
comment about it not being thermogenic is actually very helpful because I think patients are afraid, right? Like, am I going to get burned?
Right.
So, mhm,
Yeah, this is not creating heat. This is not to destroy tissue. This is not to ablate, as some lasers are. There are different classes of lasers. The type that we would use and this LED light type of therapy is not thermogenic and therefore should not destroy tissue or harm you.
okay. So, would you recommend that the closer it is to the skin, the more effective it would be for home
Yes.
use?
And it's not even about my recommendation. That's what the science says.
Right, right.
We know that where if you have it closer to the skin, you will get more penetration of the
Mhm.
light into the tissue.
Sure, that makes sense.
Yeah.
Okay. And how does PBMT work at like a cellular level, and especially with reproduction? How does it affect the reproductive system?
Yeah, I mean, the great thing is that we've got a lot of research based in other areas of medicine. So you've got a lot happening in neurology, in wound healing, in pain management. And so we can
Hmm.
take some of the mechanisms that they have found and apply them in the reproductive health space. And so we're still learning quite a bit about how PBMT might work. But when you put a light source, like a red light LED panel or an infrared laser for that matter, and it's placed nearer on the skin,
Hmm.
the light, which is photons. You might remember from middle school,
Hmm.
the single unit of light is a photon. It's a wave of energy. It penetrates the tissues and interacts with these really cool molecules in a cell called chromophores. And when they stimulate the chromophore, it will respond to the light and then go to like this cascade of effects. And they can go either locally, and even in some cases, it can be a systemic effect for the whole body, not just right at the place where the light is.
Hmm.
So, the first thing we know that it does is it does increase blood flow in the local area. And then by increasing it in the local area, it somehow is signaling the rest of the body to also open up the blood vessels and allow you to have better blood flow to the extremities. This is one of the reasons why we discovered that this could be helpful for people with infertility.
Sure.
I wouldn't say we did it. It was a Japanese doctor whose name uh, is it? I don't want to misname him, so I'll give you that one at the end.
Thank
Um,
you.
the other things that we know that PBMT can do based on other research is that it boosts the cell's mitochondria to increase ATP production. And what do we know about that? Is that it like helps it work more efficiently.
Hmm.
That helps the cellular function. And the light also really interesting to me anyway, is that it can turn on this mechanism that helps support cellular repair. And so one way it does that is through reducing reductive I'm sorry, it reduces the oxidative stress.
Hmm.
Um, I think the final thing I would say, which is really beneficial for people with endometriosis or any other type of pain, is that the other wonderful things that happen are reducing inflammation and
Hmm.
reducing swelling and pain with laser and LEDs. So I I think those are our primary mechanisms that we can look
Sure.
at as how this might help.
Well, so let me dig a little deeper as a clinician to ask you this question, because of course I'm
Sure.
like thinking about all the ways to use it. And
Sure.
so specifically in an IVF cycle, what do
hmm
you think is the best timing for incorporating PBM either at home or with acupuncture?
I don't think we know the exact answer for that,
Okay.
but that's the
Fair.
honest answer.
Fair.
Okay.
Yeah.
And in my clinical experience, I like to start at a minimum of 6 weeks before the egg retrieval.
Mhm.
For frozen embryo transfer, same thing. Um, And then I continue with treatment up until egg retrieval. And if they're going to do another one, I keep going. If they're not going to take a break, I might do like one after after the retrieval so that they can settle everything down with the pain and the inflammation and the
Yes,
swelling after the
exactly. That's
surgery.
exactly what I was thinking was post-retrieval. It'd be
Yes,
perfect for
post
recovery.
retrieval, yes,
Hmm.
is really great in that recovery period. And then I might even encourage them to use the LED panel during their period after that egg retrieval
Hmm.
because that one can be that can
A
be a
rough
real
one.
bummer, that one.
Yeah. And
Yes.
what's the frequency for treatments during the egg retrieval process, and then also during an FET when they're prepping for transfer?
We don't know the exact dose at this
I guess I
moment.
mean anecdotally for you, what you're
Yes, and
recommending.
well, I
Yeah.
want to be clear because I want to make sure that
Yes.
everyone knows that I'm not the full I don't get to make these decisions. I think it should be in the collective. But I do think what we can tell right now, based on
Hmm.
evidence so far, is that twice a week at a minimum for laser and up to 3 times a week for LED. There is such a thing as too much. So there's this dose response curve that occurs
Hmm.
in LED and or really just in PBMT in general. And you want to be on the side that is promoting the all the good stuff because if you go too far you actually move into the inhibition phase where
Hmm.
you're getting more inflammation, you're reducing the cell's ability to reduce the oxidative stress. You're actually inducing it at that point.
Right.
And so we don't want to go too far, we want to go just right, want it to be like Goldilocks in some
Yeah, and
respects.
yeah, and thank you for saying that. And I really appreciated that part of your class too, because I think we're kind of in this culture of more is better. And
Right,
so, and patients
right.
for sure, they're like, I'm doing it 3 times a day. I'm like, oh, no, I think
Please don't
that
do that.
that's excessive. But um, and I know you probably don't have an answer to this, but what it sounds to me, and when you're saying twice of laser, that's obviously in clinic. But
Right.
the 3 times of LED, that would be a combination of at home as well as with acupuncture.
Yeah.
Hmm.
So if you are, let's say, coming into the clinic, I see you, I give you acupuncture, I use the LED panel just like you do. I put
Hmm.
the panel, I kind of hang it over. I use the one that has the arm that hangs
Yes,
over and
nice.
put it as close to the needles as possible. Um, and ultimately to the skin. I also angle needles downward, typically towards the uterus, so that I can get it a little bit closer.
Nice. Yes, thank you for that
um,
tip,
yeah,
Dr.
no
Lee.
problem. Yeah, no problem. And then I'll do that once or twice a week, and then they could supplement with another treatment at home, so that's adding up to 3 a week.
Okay.
And it just, we're very flexible here. It doesn't have to be, you have to do three in order for this to be effective. I'm seeing in my own clinic where twice a week has really been very effective because
Hmm.
people did not buy the panel themselves, and we're
Sure.
just treating them with acupuncture in clinic with the LED light, and then they might do TEAS, the transcutaneous electroacupuncture stimulation at home between sessions.
And have you seen an actual point of like 4 to 5 being not as effective?
I'm basing that on the literature around the response to too much treatment. And
Hmm.
so, Soluma has recommendations about try
Hmm.
to do this about 3 times a week. I
Sure.
also trust their data about that. And then with laser, when you look at that response curve, more treatments does not mean better outcomes. So
Hmm.
it's really about getting roughly 2 times a week, at the
Okay.
most three.
That's important. I think that thank you
Yes.
for sharing that information. I think that's really important to stress for patients, especially when they're buying a unit at home and using
Yes,
it
we want to
themselves.
stay on the stimulatory side and not the
Yes.
inhibitory side.
Right,
Right.
right, right, for sure. And so going back to the lasers,
Yes.
generally, yeah, with the laser treatment, the infrared, um, I get questions about that a lot because patients, some patients want to purchase stuff on their own.
Hmm.
And I don't really know what to say because I'm not familiar with the products that are out there for like personal use. What would you recommend for patients that are kind of exploring that avenue? Is it something that you would maybe suggest that they go to a practitioner that's been trained and has
Yes.
a more
Hmm.
professional grade laser versus getting something on Amazon that
Right. I think this is such a great question. It's not that you can't buy something, but it's
Mhm.
really more about, do you want to optimize your resources to get the best outcomes? And so I don't know what the quality of the laser is. I don't know actually that it's emitting what it says on the label that it is. And I don't know that it's FDA approved. So
Right.
those are three important things that I'm looking for.
Hmm.
Can I verify that it is emitting what it says it does? Is it FDA approved for use by for home and for practice? And and can you verify it? Can you use a light
Hmm.
meter to verify that it's actually emitting what it says it is?
Right.
And that's
Right. Good
expensive to
point.
also buy.
Yes, definitely. I've been looking into them since your class. So, do you by any chance have a laser with you right now?
I don't have the laser with me. It's in my clinic and I am at
Okay.
home. I'm so
No
sorry.
worries. No
I
worries.
woke up this morning and I realized I forgot it. I was like,
No
no.
problem. No
Yeah.
problem at all. So, is there any current research on PBMT and fertility outcomes that you'd be able to share with us?
Yeah, there's not a ton of research, and I think we're still learning about all the ways that PBMT can really benefit people with infertility. But here's what we do know is that there's, one study that showed that it improved people with low quality, low count and low motility of sperm, where those were both improved with getting laser. Not on their testicles, but on other parts of the body. And I think it's
Hmm.
important to say that because
Hmm.
putting red light LED panels and putting laser directly on the testicles is not recommended um, for fertility purposes. I think what we also know is that the first evidence for helping people with ovaries for women is that in Japan, as I mentioned earlier, there was a clinician that noticed that women who had severe infertility had failed or not been successful with their assisted reproductive treatments. He was treating them and they had been trying for like 6 years on average. And about 21.7% of them then became pregnant and had a baby. They delivered a child.
And this
And
was natural conception.
yes. And
Okay.
so
That's
that was the first
incredible.
evidence that kind of like, oh, maybe there's something here because their
Hmm.
cycles became more regular and then they
Sure.
were able to conceive. Now, it wasn't everybody because there was like, I think 500 people in that study, but 21% of those people, that's pretty substantial
Hmm.
um, for having the history that they had. There's
Sure. That
been
is.
one large randomized controlled trial where laser acupuncture was applied and compared to like needle acupuncture, sham laser, a couple of other arms. There's a lot of arms in the study. And what they found was laser acupuncture improved the odds of implantation by about 38%
That's
compared with
huge.
sham laser. It's huge. And that was also they compared it also to no treatment. So it was about 38% their odds ratio. And this was for people going through a fresh embryo transfer.
Mhm.
Now, what they didn't see is an improvement in clinical pregnancy rates. So I think that's important for us to know, but we did see a significant improvement in implantation. So does it have an influence there? That's another research question for us to keep exploring.
Sure.
And then there's one other observational study. This is not a randomized control trial. There's over 400 women who were undergoing IVF in Denmark, or I think it's Denmark.
Hmm.
And they did laser over their abdomens twice a week for 6 weeks. So that was 12 sessions. And they had a 65% pregnancy rate with IVF. Now, what's important to know about that particular study is there's no control arm. So this was just, they followed a group of people who went through IVF and they self-selected. So this is an observational study. So there's biases here, but it's still signaling to us, wow, that's a lot of people who got pregnant out of 400 women.
Hmm.
And so they are following up with a research study in New York City right now at a clinic, and I can't remember the name of it, but you could reach out to the Giga Laser folks. And if you're in that area, if you're in New York City, if you want to participate in that study.
That's
And
amazing.
I
Yeah.
know,
Yeah.
um, but that's limited. You know, that's three studies I really refer to here, maybe four
Sure.
at the most with if we include the folks with
But it's
sperm.
still
But
very encouraging, and I feel like the future for PBMT is it's just going to continue to grow, and the accessibility of it too for
mhm,
practitioners and for
agreed.
patients to be able to use. I think that I'm always looking for things that patients can use on their own too that are safe
Yes.
between treatments. So
Same.
PBMT is a great, great tool. And it's so nice to know that there's some data that's coming out and in the works too. As far as well, let me just back up just to make a comment. So it sounds
Yeah.
like the data is showing that PBMT can be beneficial for IVF patients as well as for natural fertility, for
Yes.
enhancing natural fertility, which is great
Yes.
because I'm sure like in your practice we're seeing, a whole combination, right? We have a wide spectrum of fertility patients that we're seeing that are either
Right.
trying naturally or they're in some kind of ART process or treatment. So it's
Right.
always nice to know that there is something you could do no matter where you are in your journey for fertility
Mhm.
that can be beneficial.
Yes. Yeah.
And not to mention, I feel like it's so calming. Like
I agree.
I don't know if you've used it much on your own, but unfortunately, I've thrown my back out a couple times. So I have used it on myself in the pain setting, and it just
Yeah.
is really relaxing. I just feel there's something about it that kind of helps to downregulate my nervous system a little bit. And oftentimes I fall asleep for like a little nap too, because it's on a,
Wonderful.
30-minute setting. So
Well, I mean, to your point, there is evidence that PBMT does elicit a response of endorphins. And what are endorphins? They're the
Mm,
happy blood chemical that helps reduce pain and helps you feel more relaxed. That makes perfect sense to me. And then we also know from the fertility research, and I didn't mention this a few minutes ago, but when you use the laser on someone's neck over this thing called the stellate ganglion, it's like a little bundle of nerves by your jugular and your um the oh my gosh, what is the artery that goes to the brain? um
you think carotid
wow.
artery?
Yes, it's
Carotid artery.
wow. Holy cow. Menopause, I tell you.
Me too. I'm
Uh
with you there, Dr. Lee.
Thank you. Thank you for that grace on there. But anyway, so it's helping to vasodilate both of those
Mhm.
vessels, and you're getting more blood flow to the brain, which helps you to downregulate your nervous system. You're getting also then a systemic increase in blood flow because you're getting vasodilation everywhere.
Right.
And so it makes perfect sense to me that even with pain, because if you're in pain, usually those little vessels get all nice and crunchy anyway. You're opening those up, and then you have downstream influences on the rest of the body. I love that you
Mhm.
get that relaxation benefit
Yes.
afterwards. That's
And it's
awesome.
such a great complement to acupuncture because
Yes,
acupuncture works on
agreed.
such a similar level and mechanism that it's like it's great to do together or, adjunctively. But let me ask you a little bit more about TEAS,
Sure,
which you translated beautifully, transcutaneous electroacupuncture stimulation. It's a mouthful for sure. How
it
is it
is.
different than traditional acupuncture?
Well, you're using electrostimulation pads, those electrodes that would
Hmm.
often be used in what everyone probably has seen before, which is TENS
Sure.
or transcutaneous electrical nerve stimulation.
Hmm.
The difference really between needle acupuncture is that, you're using a needle in acupuncture. You could electrically stimulate that needle and elicit some of the same effects with teas. You might get it in a slightly deeper level with a needle, but teas being on the superficial level is affecting different nerves and still having some of the same effects. So, transcutaneous electroacupuncture stimulation is a really safe and easy way to treat yourself with guidance. Of course, you need to know where to go, how to apply it, how to set the machine. And I really like it as an at-home therapy as well, to complement or supplement what we're doing in clinic if someone can't get to me as regularly as they'd like to, or maybe
Mhm.
they live too far,
Sure.
or they just like, I don't like needles. Can we just do that? That's also okay.
I love that as an option. And I know, like, for some of our patients, I feel like they can use, they can benefit from more treatments, but unfortunately,
Hmm.
financially, it's a little tough, right? Especially if they're paying
Yeah.
for IVF treatments and multiple
Yes.
cycles for some couples. So I love that Tease is available for them. And just for listeners, what's the average cost of a unit that is, that someone can purchase on their own,
Yeah.
not from a professional source, but for
Right.
home use?
One that is effective and available very easily. You can get it in lots of different places. It's less than $100. It's a
Wow.
very effective way to supplement your therapies. You can use it also in labor and delivery or for other pain issues. So it's not like
Yes.
it's just going to be only for fertility. It's not
Right.
limited to that.
Multi-purpose.
Yes. Thank you
Hmm.
for that word. That's perfect.
Well, if you have a tease unit that you
Yeah,
recommend, if that's okay, I'd love to add it in the show notes and add
sure.
that link.
Yes, I will give you that.
Thank you. Thank you so much. Because, there's a lot of talk about Saluma, but when it comes to teas, units, I'm kind of always like, I'm not sure.
Right. Well, there's like two channel ones, there's four channel
Hmm.
ones, there's preset ones. You do not want those. You don't want a preset one. You don't one that says it has like a cupping setting and a needle setting and a harmony
Hmm.
setting. You don't want that. Because we don't know what those numbers mean. You want one that you can actually change the certain parameters for the treatment, and you want four channels for
Four
um
channels. Okay.
yeah, for
Okay.
treatment to support fertility.
And is it true that most of the machines have a tens tease option? Like you can do.
You don't need to make a new option for that. It's because you're changing the settings for like the frequency, like how quickly is the
Mhm.
stimulation happening, and you're also changing how wide the stimulation is. So like a short stimulation, a small the pulse wave. When it's shorter, that's better for pain because it numbs things, and a wider
Mhm.
one allows for a stronger pulse. And you're also going, I'm not saying this very clearly. Let's say this in a different way. There's two things that are important to know about teas for fertility. You want to know how frequently are you getting the stimulation and how
Mhm.
wide or narrow that stimulation is. And so you want it to be wider and you want it to be slower.
Okay, that makes sense. Versus pain.
Pain will be faster and
Mhm.
more narrow.
Got it. Okay. Thank you for distinguishing that. I think that's
You're
important
welcome.
for home use
Need
for
to
sure.
fix something here. Hold on, because I keep getting this message and I want to get it off my screen here. There we go. Okay, got it.
And just going back to the tease treatments for home use, what's usually the length of time that is suggested?
So for the duration of a single treatment is about 30 minutes. And then
Mhm.
I tend to encourage people to do it like twice a week. In extreme cases, I might have them do a little bit more, but
Mhm.
only one more a week if like I can't see them and they need really a lot more support. And it could be just once a week. So I'm seeing them once a week and then I want them to do one other treatment. It could be just one time a week, but it's 30
Okay.
minutes because it helps you feel more relaxed, because you're getting this nice surge of endorphins before
Mhm.
bed, and you're getting warmer and you're feeling more comfortable. I like to have them do it like an hour before bed. So you get your
I love
30-minute
that.
treatment and then then you can get ready for bed and go right to sleep.
I'm sure they sleep a lot better too.
I get that feedback a lot. Yes. Yes.
So, for patients that are trying naturally, is there
Mhm.
a time in the cycle that you would recommend them to avoid PBMT, like LED light therapy or Tease treatments?
Yes, I'm really glad you asked this because part of doing these treatments at home is really being informed on how best to use them so it
Mhm.
optimizes your outcomes. Because tease is not something you want to do in a cycle where you've tried in the luteal phase. So after you have either done timed intercourse, you've had an IUI, or you've had an embryo transfer. You
Mhm.
do not want to do it after that. So anytime that you could potentially be pregnant, no tease. I also don't recommend it using the same settings for fertility during the period. So I would want to adjust them and I would tell you how to do that, where to place the
Mhm.
electrodes, because it's going to be different.
Right, right.
But the key here is that your luteal phase in a cycle where you have tried to conceive and you could potentially be pregnant, you don't want to use LED lights, you don't want to use laser, and you don't want to use transcutaneous electroacupuncture stimulation.
Thank you for clarifying that.
You're welcome.
Yeah, that's an important thing for patients to know, especially for home
Yes.
use.
Yes.
So, as far as I know, TEAS has probably more data out there than PBM therapy, so PBMT. So, I'm just curious on any recent research on TEAS that you'd like to share with us.
I think that there's actually way more data on
Mhm.
transcutaneous electroacupuncture stimulation. Um, and I think one of the great things that we know now is that we have a meta-analysis, and there's 19 trials in that meta-analysis with over 3,700 people who were going through IVF. So it's actually specifically the one of the patient populations we're really interested in. And what they found is that teas increase the chance of live birth by about 42%. And it's not just
Fantastic.
one, I
Wow.
know, right?
Wow.
Live
Yes.
birth
Hmm.
after an IVF. Now, these are studies that are coming, oops, sorry, these are studies that are coming from um, China mostly. Some have been in other countries, but mostly they are in China. And so we don't know if we would actually see the same um, outcome here in the US, but I can't imagine that we wouldn't see some benefit if we were able to do a trial on it here. The really key thing here is that these aren't just one treatment. It's usually a series of treatments. And it's if you look at all of the studies that are included, you can see there's a little bit of variability in what they do as far as the treatment goes, but the frequency is pretty consistent. It's usually twice
Okay.
a week or 3 times a week for several weeks before they do the embryo transfer, and then they don't do anything after embryo transfer.
Hmm. Yeah, that makes sense. Is the study also incorporating tease treatments during the egg retrieval as well? Or
I
did they not
imagine
collect
there.
that data because it was mainly on
That's a
FET?
great question. I don't have that particular paper up
No
right here,
worries.
and I
I
can't
was
look.
just
But
curious.
we can talk about it afterwards.
Yes, for
I'll go
sure.
look at the
To be
paper.
continued.
Yes,
And
great question. I
I'm
don't think
also
so.
wondering too in China if they've ever done a tease acupuncture combination study.
Oh, I'm sure in that particular meta-analysis, there are mixed interventions, and they only pulled out the tease arm to see what the outcomes were compared to the sham or the no treatment. That's a great thing also about tease is that you can do a better sham with that particular
Mhm.
or placebo treatment with that. But I'm just trying to look at that study in my mind's eye, and I'm not recalling if they did it during ovarian stimulation. I don't think they did it singularly. It could have been fresh cycles, and I imagine there's some FET studies in there too.
Mhm. Yes. Okay, great. I'm excited to look at that study too.
Yeah. Now we'll look at it more critically.
Right, right. And I think, as a practicing clinician working with a lot of IVF centers and working around those types of cycles, of course, these are always the things that I'm thinking about, like timing,
Right.
when to use it, when to not use it, and,
Right.
like if it's going to be beneficial for FET support or not, or do we just only use it during stimulation? So I'm a lot of these questions are more like clinician geared. So, but
Well,
I
but
think
they're also,
patients can
yeah.
benefit from that
Sorry.
too, just knowing like, okay, this is why we do certain things during certain times of the cycle, or during certain times of the IVF process. So,
Yeah.
any other suggestions or any type of recommendations that you would have for patients before they start using PBMT or TEAS?
Well, I think there's a little bit of overlap on people who really shouldn't use these two therapies, and it's like people with pacemakers.
Hmm.
Um, if you're currently pregnant, you don't want to use it. Um, Although you can use laser and PBMT for pain management away from the lower abdomen and the low back,
Hmm.
as the pregnancy proceeds. But I tend to avoid any of those therapies in the first trimester for sure. You don't want to use teas also while during pregnancy, except for labor and delivery, because it can be very
Sure.
helpful for pain management there.
Hmm.
If you have an active cancer tumor, you don't want to do treatment over the tumor. And if you have a history of deep vein thrombosis or you
Mm,
have one currently, I would avoid using both PBMT and TEAS. Why? Because it causes the vasodilation. And if you're opening up the veins and you have this blockage, we do not want you throwing a clot in your lung. So that's a reason why
correct.
we don't do that.
Yes.
And
Yes.
as I've
Lungs are
said
important.
before, I don't have people do it during their period, the tease treatment, because that can cause you to bleed more heavily, and that's
Hmm.
not great,
Hmm.
especially if you're a heavy bleeder as it is. And then the final people I might think about limiting how much I do is I would probably use teas. It's not that I probably, this is how I practice. I use teas in people with with a large ovarian reserve before they start the egg retrieval. And once they start the egg retrieval, I stop and just do acupuncture and red light / laser. I don't continue to do the stim during the egg retrieval simply because I do not want them to hyperstimulate. And I don't want us to ever look back and say, oh, well, you did this too. And we don't want to
Right.
put
That's a
anybody at
really great
risk.
point. So we're looking at patients with like polycystic ovarian syndrome, for example.
Yeah.
Right.
Yeah.
So
For
you would
example.
just recommend the teas to be done as they're prepping before they actually start
Yes.
their
Yes.
medicated stimulation or the medications for stimulation.
Right. And why would I want to do that? Is
Yeah, that makes
because,
sense.
TEAS has other functions in addition to, opening up the blood vessels and helping
Mhm.
to reestablish a conversation between the deep brain and the pituitary gland and the ovary so that loop gets back on a normal feedback.